It's not just about fixing a specific area, it's about addressing all areas because issues tend to be multifocal. Does spinal stenosis occur in just one area? The most common sites for spinal stenosis are at L4 and L5. It would be better if spinal stenosis only occurred at L4 and L5. However, people often leave it untreated, allowing it to spread from L5 and L4, which is the worst way to further affect L3 and L4. For some people, it can spread up to L2 and L1. Spinal stenosis can also extend to the sacrum. Spinal stenosis can develop in multiple areas. If this appears in 1, 2, 3, 4, or 5 places, then only the most severe area or the next most severe area will be addressed. If individuals with good health or cardiopulmonary function have spinal stenosis in multiple areas, up to 3 areas can be treated, and the rest can be addressed in a subsequent treatment session. It is done like this because spinal stenosis occurs when bones and joints enlarge and press on the spinal cord. When surgery is performed to cut bones and joints, only 1, 2, or 3 places can be treated. However, most people develop spinal stenosis in all 5 areas. Some people develop spinal stenosis in 3 to 4 areas. Spinal stenosis occurs in multiple areas, such as here, 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 and here, as the ligaments become thicker. This mostly occurs in the area between L5 and L4, but it could also happen in other areas. If L4 and L5 weaken, this consequently weakens L3 and L4, and the load will shift to L2 and L3. Eventually, due to this weakening, it cannot do its job. Spinal stenosis can also radiate down to the sacrum. It is the pelvis' job to provide support for our spine. However, even the first lumbar vertebra at the sacrum develops spinal stenosis, which occurs in multiple areas. Treating this condition surgically by cutting bones or destroying joints is quite extensive for all 5 areas, even 4. Therefore, doctors usually treat only 1 or 2 areas, but the side effects last for the patients. Hence, it's advisable not to use methods that involve cutting the lumbar spine or discs. Of course, the spinal discs can press on nerves, but let me explain this further. The nerves could be pressed from either the front, nerve hole, or behind in various directions, but fixing the disc or the nerve hole is not necessary. There is no need to cut the disc, and it is better not to fix it. The ligaments between 2 lumbar spines, however, thicken and squeeze the nerves. Yes, it pushes on nerves from behind. If we observe and remove this bad ligament, the cerebrospinal fluid and blood circulation will be restored without interruption, allowing patients to walk comfortably without pain or paralysis, just like after decompressing a drain. Spinal stenosis must be treated entirely. It's not just about fixing a specific area, it's about addressing all areas because issues tend to be multifocal. The most suitable method for treating multifocal spinal stenosis without the issue of bleeding or blood transfusions and without cutting bones is ligament reconstruction surgery. One of the advantages is that it can be performed even on individuals aged 70, 80, 90, or 100, as it doesn't involve bone cutting or disc removal, focusing solely on repairing ligaments and enabling them to walk well again. A person with multifocal spinal stenosis in 5 areas initially underwent surgery for the most severe area at a different hospital. What happened next is that this patient developed paralysis. Treating only the affected area, the areas above and below were compressed again, leading to ankle paralysis. The ankle needs to be able to flex to walk. With paralyzed ankles, it can cause tripping on uneven surfaces, such as a door sill. When crossing a door sill, one may trip, causing difficulty in walking, and one's feet may drag. Ankle paralysis should be avoided at all costs. If ankle paralysis occurs due to spinal stenosis, all 5 areas must be corrected. Because the nerves that go to the ankles are connected from L2 to L3, L3 to L4, and L4 to L5, all 5 areas must be fixed. Therefore, a safe method to correct all 5 areas without bleeding as soon as possible is through ligament reconstruction surgery.